Hello and welcome to this oral hygiene session named Teeth Are Treasure, in which we will be covering teeth brushing techniques, interdental brushing, tongue cleaning, mouthwash, and flossing. So why is brushing so important? Mainly because it stops plaque growth, which kind of looks like this, and to remove food bits, which kind of looks like these, or this. Classification of brushing techniques: the vertical techniques, in which we have the rolling method, the modified bass, the modified Stillman, and the vertical known as the Leonard technique. In horizontal, we have the horizontal technique itself and the Charters method. In circular, we have the FONE'S technique. In vibratory, we have the bass method, the Stillman, and in others, we have the occlusal, scrub, and the Smith technique. If you like the video so far, please pause and subscribe. Starting off with the first vertical technique, we have the rolling technique. Its indications are for general cleaning and to be used in addition to bass and Stillman. Advantages include children who are learning to brush and does not require much dexterity. Disadvantages: does not clean the sulcus area and it is time consuming. Now the technique itself. Step 1. Brush placed on the side of the tooth with plastic part at level with the biting surface. Step 2. Wrist is turned so bristles follow tooth outline. Step 3. Do the same for the inside teeth. Step 4. Repeat step for front teeth. Step 5. Occlusal brushing for biting surface. Moving on to the second vertical technique, which is the modified bass technique, also known as the sulcular or the sulcus technique. Its indications: patients who are healthy and want to maintain a good gingival health. Second, patients with periodontitis. Advantages: it's the only technique that cleans the sulcus. It's the best technique for cleaning the sulcus. Disadvantages: it's time consuming. Second, requires good dexterity. Now the technique itself. Place bristles inside the gums, holding the brush at a 45-degree, then slightly wiggle the brush back and forth, followed by rolling the brush towards the biting surface before moving to the next set of teeth. Second, do the same for the inside teeth. Step 3. Repeat the step for the front teeth. Step 4. Occlusal brushing for the biting surfaces. Now, moving toward the third technique, which is the modified Stillman. Its indications are patients with gingival recession, patients with gingivitis. Advantages: it provides good gingival stimulation. Cervical plaque removal is achieved. Disadvantages: 1. It's time consuming. 2. May damage the epithelial attachment. Technique. Step 1. Place bristles on gums by holding the brush at a 45-degree angle, then slightly wiggle the brush back and forth, followed by rolling the brush towards the biting surface before moving to the next set of teeth. Step 2. Do the same for the inside teeth. Step 3. Repeat the previous step for the front teeth. 4. Occlusal brushing for the biting surface. And now towards the last vertical technique, the Leonard technique, also known as the vertical technique. Its indications: overlap teeth and wide embrasures. Its advantages: it's convenient. It's for children who are learning how to brush. Its disadvantages: interdental area of permanent teeth are not clean, may harm the gingival area. Now the technique. Step 1. Hold the brush at a 90-degree angle in a way that all bristles are facing the tooth surface. Step 2. Make vibratory up-down strokes across the entire arch. Step 3. Do the same for the inside teeth. Step 4. Move the brush from the gums to the biting surface for the front teeth. Step 5. Close the brushing for the biting surfaces. Thank you guys for watching. That's about it for vertical techniques. If you like the video, please press the like button. And for knowing other techniques, please subscribe and do let me know which techniques do you use. Thank you.